Hello, and welcome to the Madness and Grace podcast, where we talk about mental health with an eye on our faith. I'm Dr. Matthew Stanford, and with me, as usual, is Dr. Madeline Stiers. How are you today, Maddie?
I'm doing good. I'm good. How are you?
I'm doing well. So I'm excited about this topic today. It's something that we run into all the time. I don't think people really understand how big of a negative impact this has on individuals in our society. And that's the idea of really kind of the myths related to mental health, but the stigma that comes out of that. In fact, one of the top reasons that people don't receive mental health care is because of stigma, really, because of the shame, they're concerned they're going to get kind of outed if they go to a mental health care provider or tell someone. So this is a huge issue. And some of these myths that we'll talk about today really are because people just really aren't well educated about mental health. And sometimes they're cultural, sometimes they are just naive. And so what are some misconceptions you've heard in relationship to mental health in your clinical work or through the clinic at the Hope and Healing Center?
Yeah, I think some of the myths that surround mental illness are pretty pervasive, and people think that they are actually true. When I think of myths around mental illness, obviously the first one that comes to mind is related to suicide. So not specifically like a specific mental illness, but people who struggle with serious mental illness often have thoughts of suicide or have tried to die by suicide. And people think that if you ask someone if they're having thoughts of suicide or if they're thinking about killing themselves, that will put the idea in their head and that will actually push them towards making that attempt. And in reality, that's just not the case. People are much more likely to tell you the truth and be honest, like yes or no, I have or have not been thinking about suicide. But the myth is that if you ask someone, you're planting that seed and that's going to spur them on to take that action. That's just not true.
Yeah, that's a real classic one. I think that's existed for a long time. Particularly parents will tell you that they're afraid to ask their child. I think one that I hear a lot that really, again, uh, I don't know if I call it a myth or a misconception or a misunderstanding. Is kind of a pervasive idea in the general population that mental illnesses aren't real illnesses in some way, that they're just in someone's, I guess no pun intended, they're just in someone's head. It's, that person is depressed because they just want to be depressed or they just don't want to do anything, and that there's not real illnesses. And a lot of times I see that associated with things like, well, there's no blood test for a mental illness, or there's no tests that can show, or you hear something like no one's ever shown that there's really a chemical imbalance. And all of those are just wrong. I mean, those are just wrong statements. And so I think that idea that these things just don't exist or they're not real, and someone can just decide not to be that way. I hear that quite a bit, or I see that quite often.
Yeah, it kind of leads into the idea that mental illness is a weakness or a character flaw of the person, and that people can just, quote, get over it, or just don't be sad and pick yourself up by your bootstraps and move on. And the reality is, people have bouts of depression or anxiety, stressors in their lives where you can kind of talk yourself out of it and move through the stress. But if you have a mental illness, like a diagnosable mental illness, like oftentimes you can't think yourself out of it. It's more pervasive than that. And that just adds to the struggles that people get with reaching out for help. And I could go on and on about all that. But yeah, it's not a weakness. It's not a character flaw. And it's real and it does exist. And yeah, people need to be more cognizant of that.
I mean, what I would say in the context of myths is we really need to start with the idea that, we have a brain in our head. And a lot of people forget that. I mean, we talk a lot about the other organs in our body, but we really don't talk about our brain very much. And that brain can malfunction or not work right. And certainly if your brain isn't working right, you're going to have odd thoughts or emotions or inability to control emotions or behaviors or things like that. And so we always feel like we're fully in control of those things, and to some extent, we are in control as long as things are working right and we have the right kind of skills to do that. But certainly, we know that someone can acquire a head injury, and that can cause their change their behavior, their thoughts, their emotions, and we don't really have a problem with that. We don't say to that person, "Oh, well, that's you just need to stop doing that," you know. And so, I think these myths a lot of times are just kind of, as I said earlier, kind of a lack of knowledge. Now, one thing I would also suggest is that maybe the way we portray people with mental health problems in the media, like in films or on television or just in popular culture in general, may kind of lead to some of this. Have you seen things like that, or do you have any thoughts on what that may do to this?
Yeah, I think you may have more to say about this in regards to myths about mental illness, but I think there's a huge myth, and you see it in media and it's portrayed this way, but that people with serious mental illness are violent and that they are out wreaking havoc and causing damage and hurting people. And that's just not the case. I mean, I think you might be able to speak to the statistics of like actually how many violent acts are um, attributed to those with serious mental illness, but I think it's like 3 to 5% of those are.
It's very small. I mean, obviously, far more people without mental health problems commit violent acts than
Mhm.
people with mental health, because there's just far more people that don't have mental health problems. And the data suggests that uh, people with mental health problems are actually, when you just like mental health problems in general, are actually more likely to be the victims of violence than the perpetrators. Now, there are certainly contributing factors associated. So if you look at data where you take someone who has, say, a psychotic disorder, and they also have a substance use disorder, an active substance use disorder, those individuals are more likely than the general population to commit a violent act. But again, that's a very small percentage of people who have mental health problems. Just because you have a psychotic disorder does not mean you're more violent. You have to kind of add these other things, and it's really kind of an additive effect as well. If you're a male, you're more likely to be violent than if you're a female. If you're a young male, you're more likely to be violent than if you're an older male. So I mean, it kind of starts to kind of add up as you put these things in, and then a mental health problem might just be, depending on the type of problem and if there's a substance use issue, be added on top of that kind of equation. But overall, people with mental health problems are less likely to be violent than the general population. But you're right, you see that, and back to the idea of media. I mean, when was the last time you went and saw a movie that had a bad guy in it, like a violent bad guy, that he wasn't crazy, quote
Mhm.
unquote, in some way? I mean, that and I used to, as a scientist, my whole life, before I came to the Hope and Healing Center, I was a neuroscientist, and I always was taken by the fact that most scientists and meet in movies that really do something kind of malicious or wrong, they're always the mad scientist.
The
I mean,
mad.
Dr. Frankenstein is a perfect example.
Yeah, yeah, it's interesting because, and I mean, you talk about media, it's portrayed that way, but you also watch the news and you hear about all of, mental illness and this person that did this thing, when reality, like the violence is, there's so much more violence than just that, but it's what's catching and what people are going
Right.
to listen to. And so you see that and people start to think, oh, every violent act is committed by someone with a mental illness. And in reality, it's really just trying to get viewers to watch and kind of scare them.
Right. Yeah, and there is a narrative. I mean, like you mentioned the media, the news media. And so like whenever there's a mass shooting, which is very hard for anyone to understand why someone would go out and particularly kill strangers. Um, they oftentimes will say, "Oh, well, the neighbor said," or "We've heard that the person had a problems in his past with mental health." Well, I mean, you may hear that, but I don't know that that even means anything. I don't even know what that means. I mean, that doesn't mean the person had a mental health problem, but you hear that all the time. In fact, what the data of mass shooters shows is that actually only a small percentage of them actually had a kind of actually justifiable mental health problem. There's actually data that showed they have it. I mean, a third of all mass shootings are domestic violence kind of a thing. A guy goes and shoots up a church because he wanted to kill his ex-wife, and her family, and he just ends up shooting a bunch of people that are there as well. I mean, that's a domestic violence issue. Now, you might say, well, that guy's crazy because he did that, and I certainly can understand that, but we're talking about a diagnosable mental health condition. I mean, did he go do that because he had depression? No. He went and did that because he has a conflict with his wife, and he felt like there was no other option or whatever. So no, I think that's that's a real, the media, I think, is a real problem here. Because imagine you're a person with a mental health problem, and every time you turn on the news or you watch a movie, you're portrayed as if you're the violent thing to be afraid of. Of course, you're not going to go to a mental health care provider. Someone might find that out. I mean,
You're not going to tell anybody either.
no way, no
No.
way. So we always talk about issues of faith on here, and what about faith communities? What have you heard? We use a faith-based approach to care here at the Hope and Healing Center. What have you heard from your clients or from those that we see in relationship to myths? I have some horrible stories I can tell. I may or may not tell them of what people have told me has happened to them when they went to faith community. But what's something that a myth you've heard related to spiritual issues or faith communities?
Just pray more. You just need to pray more. I mean, I think that's the number one thing that I hear people tell me they've been told is, this is a fault of yours. Your faith isn't enough. You need
Right.
to just focus in on, reading scripture and doing your devotionals and pray more, and everything will get better. Kind of
Right.
that. And that's not helpful. I mean, it can be in conjunction with treatment and medication and other forms of support, but just to ignore that someone is showing up and saying, hey, I'm struggling with my mental health, and probably some serious ways if it's gotten to the point where they're reaching out for help, and they're just told, that's your fault. You need to
Right.
pray more and be more faithful. It's really, it damages the relationship that people have with their church, and it also perpetuates the stigma that mental health isn't real, mental illness isn't real.
Right. That's a good point. I mean, it really, it's that same myth that mental illness isn't real, like a real illness, but within a faith community, it becomes it's a spiritual problem. And so that's why you pray more. Of course, you should pray more. Absolutely. We should all be praying more. And if you have a mental health problem, we should be praying for your healing, and you should be praying for your healing. But we shouldn't be saying, well, that you have this because you don't pray more, or you have this because you have a weak faith. And we can add other things to that. You have this because it's a demon.
Mm-hmm.
And that's not to say that we don't believe in the demonic. That's to say, you don't generalize every illness to, oh, well, because I literally, as one of the bad stories that I know, I have a friend who has a son who has a nonverbal autism, and he was told by a ministry that his son had autism because of a generational curse
Mm.
that had been passed down, and we needed to do deliverance on the child, and that would cause him to not have autism anymore. And I mean, that's hurtful. I mean, that's very hurtful. And so, I hear a lot of times people will say, well, someone with schizophrenia, that's just demonic. I mean, depression, that might be something else. Uh, or they say depression, anxiety. I hear that a lot. Those are sins. And so it's a sin. And so you need to repent of that, and ask God to take that, help you stop sinning, type of thing. So I hear that a lot,
I don't
but a lot
know.
with the demonic.
Yeah. And I don't know if this is a myth necessarily, but I think most people show up at faith communities looking for help before they're going to see a doctor or a provider. But I think a lot of faith communities are not equipped to deal with this, right? This is kind of what the Hope and Healing Center and Institute talks about. But there's still this idea across faith communities that, like, we don't deal with that. That's not something I can help with. If they're even acknowledging that there is a mental health issue going on, like, that's not our realm. Like, got to go see a provider. And while, yes, you should be referring people, I think there's more that can be done in faith communities to help support. We know that social support is a big protective factor for people with serious mental illness, trauma, and all of that. And so, this idea that there's nothing that can be done and that really just needs to be pushed off into a different kind of area of care isn't necessarily accurate.
Well, I think that's a great point you make. I think in some sense that's a myth, is that there's really nothing you can do to help somebody with a mental health problem, that you either put it all into the spiritual context, or you put it all into, like, well, you need to go away and find some help, and then you can come back. And I think you make a good point that, in a couple of weeks, I'm given a talk on is mental health in the U.S. declining? And absolutely it is, and it has been since the late 90s, and really at a horrible rate. And one of the things that I think contributes to that is that fewer and fewer people are associated with faith communities or with organizations like that where they receive social support, which I think have served for decades, if not centuries, as a very much a preventative uh, kind of aspect in relationship to these types of mental health issues. And just having a mental illness isn't the only decline. People's mental health can decline and they not have a mental illness. But loneliness is the number one problem in the US right now. We're so disconnected. We have no one to talk to. We think we're more connected than ever. And so this myth that there's nothing you can do, well, just being present with somebody, just being able to listen, just allowing someone to share with you makes a huge difference. And so that really kind of gets us a little bit towards our next.
So before we jump into that, I kind of
Oh,
want to
yeah, go ahead.
the point
Yeah,
that
please.
you're talking about in your speech in a few weeks that mental health is declining, which means that overall health in America, mental health in America is declining. But that means that mental health struggles or diagnoses or illness is actually increasing. I think people
Right.
think of the
Absolutely.
term mental health as like a negative thing, right? We talked about that
Right.
a couple weeks ago on the podcast, but the mental health is declining in America, which means mental health struggles are actually increasing, whether that's diagnosable or not.
Right. Yeah, you want to have mental health. You want to have good mental health.
Exactly.
But you're right. It is almost used interchangeably with the idea of mental illness. One of the things I think that is very helpful, and I kind of hesitate to even really bring this up because I think we don't want to put the kind of the weight of changing people's minds about mental health on the people that have mental health problems. You don't want to say that people with mental health problems are the ones that got to convince everyone else that those aren't things to be stigmatized. But there is a reality in the fact that personal stories of people's struggles or their lived experience can really make a difference. And I'll just give an example of that, and then we might talk about it a little bit. And that is, if you are a person in a faith community that struggle with a mental health problem, or that you have that kind of lived experience, maybe of caring for someone with a mental health problem, and you share that story as part of your experience, that people know that you've had that story. What I've tended to see is that those that are friends of yours or recognize you within the faith community as a member of the faith community really are softened to the idea that, well, maybe this isn't the way I thought it was. I mean, here's a person that I know to be a person of faith, and they struggle with this problem. Well, maybe it isn't the way I thought it was, or maybe it happens to more people. But I do think that there's a cautionary line there where we don't want to say. I remember a few years ago there was a campaign, like a destigmatizing campaign for mental illness, and it was called "Okay to Say So." Okay, and with it's not okay to say so. And so I think that was and why should the impetus be put on the person with the problem to convince people that don't understand that it's okay? And so, in some places, if you went and said that you had a mental health problem, they might fire you. They might stigmatize you. So
Mhm.
but there's just this kind of benefit that comes from when people share their experiences. It does make a difference. So what are your thoughts on that?
Yeah, I mean, I agree with what you're saying that the weight shouldn't be put on the people who are having the experience, right? But when you do share and when people are willing to be open and communicate like what their experience has been, whether it's their own or someone in their family, it really brings more awareness to the fact that mental illness doesn't discriminate. It doesn't discriminate against the wealthy or the poor. It doesn't discriminate culturally or racially. It happens across all walks of life. And some groups or populations may not be as readily willing or to acknowledge it. And so when people start to talk and explain like this has been my experience, other people in that group or that demographic that might be experiencing it, but might not feel that it's okay to talk about, begin to feel, hey, like that happened to me too, or that's happening in my family. I can at least relate to one other person. And then that really opens the door for people to receive help and ask for care. And again, starts to break the stigma that mental illness is, bad and shouldn't be, should this be this thing that is looked at as like a fault of that person.
Right. No, I would say in faith communities where I've seen a congregation that really got it in relationship to mental health issues, and they offer support for individuals with mental health problems, and they really receive them into the congregation, tend to be ones where someone in leadership, be that as a clergy or a well-respected lay leader, has experienced mental health problems in their own life or in the life of their family, and they're open about that and they share about that, and they have a passion for that, for assisting people with those, and that really is transformative. But what I'm not saying is for those that have mental health problems right now to go run out into unsafe situations and just start sharing. We always have to be careful who we share what with, no matter if it's mental health or whatever, and we
Mhm.
always have to share the amount that they can handle. And so sometimes just kind of dumping it all on somebody, just even if it was cancer, it's just too much. And so what can we do really to kind of foster these kind of safe environments, be that within a faith community or outside of a faith community? And I'll just take off the table the obvious, which is education. Let's just take the easy one off. Obviously, education is the most important. But I would say, and you may disagree with me on and that's fine. You can tell me that and tell me why I'm wrong. But honestly, I would say that the culture that we live in right now here in the United States has been absolutely saturated with mental health education, and I don't think we do it well. And I don't think we do it at the right time frames. And I might speak to that in a moment. But I do think that the adult population of the United States right now is absolutely saturated with mental health information. And I don't think that that's made a big difference in relationship to stigma.
I agree with you. I would also say that I think youth hear about it a lot more too. It kind of goes back to the social media that we were talking about earlier. If you get on social media, there's whole, I'm not on social media, so I can't, I'm going to use the wrong terms here, but there's the whole platform where people talk about mental health and how it's important. And there's this push that like, the younger generation is talking about mental health in a way that is not as stigmatized, but you also see people taking mental health diagnoses and talking about them and kind of generalizing them into the public.
Right.
So, like, you see this a lot with narcissism. Like, every man that has been recently broken up with or exited a relationship is now a narcissist. And every woman now has bipolar disorder or borderline personality disorder. And everyone, has all these diagnoses just because maybe you were being a jerk, maybe you were, but
Right.
that doesn't mean
Right.
that you have this diagnosis. And so, yeah, I think there's a lot of information out there. Some of it's misinformation, but when it's like the platform from which it's coming and when the information is actually delivered is oftentimes missing the mark. It's after something happens, after crisis hits, and we really need to be more proactive in how we're educating people on what mental illness is and then what to do when
Right.
you are faced with that, how you actually take forward proactive steps towards care.
Right. I agree with you that there's a lot of education out there, but I think that it's so mixed up with the way it's presented isn't effective. And it's so mixed up with a lot of myth and misunderstanding and misinformation that it's almost impossible to differentiate good stuff from bad stuff. And we see that in almost any area that we news, anything, we see that. And so, I mean, my suggestion would be to target young children. We do that already with health. I mean, my son is a coach at a high school, and he teaches health in a middle school. And so they have a health class. They learn about their body. They learn about their organs. They learn about illnesses. They talk about cancer. They talk about eating healthy, and they almost never mention mental health at all. I mean, why is there not a component where they talk about the brain and they talk about mental health issues and they talk about specific mental health diagnoses. I mean, it would fit perfect into that. And so, I think if we would talk about mental health issues as part of health issues in general, as you mentioned earlier, because like you and I have said, mental health is declining in the U.S., but so is physical health. Physical health is declining. A church that has say a health ministry, which is not uncommon, where they do blood pressure checks and cholesterol checks and things like that. Why did they not also do a depression screening or an anxiety screening? I mean, I think that's the key to kind of helping individuals begin to absorb this information. And I think that's the way we can overcome some of these myths and stigma that exist in that, but we have to start with younger individuals. I think, pelting the general population, the adult population, with a lot of information about, all you're doing is fighting against myth and stigma. You got to start, if you're going to do this in a proactive kind of long-term way, you got to start with the really young individuals. I think you're right though about social media and young individuals. I think they're so overwhelmed with mental health problems, kind of adolescents, that they do talk about a lot out there, and I think that's a good thing. I think unfortunately, much like bringing people into a group where they just do kind of unstructured vetting where they just kind of vomit out all their emotions and everything, we find that not to be very beneficial for people's mental health. And I don't think it's very beneficial out on social media either if it's kind of unstructured, and there's no guidance like, oh, well, here's all my problems, but what can I possibly do? So I think we need to be more proactive. And we're much more concerned about the number of providers we have than we are about the population understanding about the problems that should send them to those providers. And all of this is related to always ultimately contributes to the fact that less than half of people with mental health problems ever receive any treatment, which is frightening. And stigma plays a huge role in that. So do these myths. I think in the faith community, we have to do better. We have to say, I'm not going to judge you regardless of why I believe you have this problem or I personally think you have this problem. That's not important. The important thing is that you're distressed and that I'm here to support you and care for you. And there are effective treatments and I can help you get to those. And, we don't do that with people with diabetes. We don't do that with people with cancer. I mean, I've never met a pastor that told someone with cancer that they understood a spiritual way they can no longer have cancer. I mean, surely out on the edges of Christendom, there might be somebody, but that just doesn't happen very often. We're not talking about, and again, we're not talking about people that say don't go to a doctor for anything. We're talking about people who say don't go to a doctor for mental health problems, but go to a doctor for everything else. So those are these weird myths and misunderstandings, and I think we can just do a lot better. Hopefully, a podcast like this can help people to understand that there is something you can do. There is an opportunity for you to step up, even if you just listen to people. It makes a big difference. And hope, I think hope is another way that we can really help make kind of these safer environments for people to share. If people believe they're listened to and they believe that they can be better, get better than they are, I think that goes a long, long way.
Yeah, absolutely. And what I oftentimes go back to, because family, if I'm sitting with a family or if you're talking with with a community of people, it can get so confused with the diagnoses and the information and all of this. And, they might feel like they have to be able to identify exactly what's going on with this person before we get them to help. Or, they don't understand what's going on with this person and their mental health. And so they go, this is not my problem, or I don't believe this is real. But the reality, especially in faith communities, is like, we want people to be happy, right? You want your loved ones and your community to be happy. So if, regardless of how much you know or don't know about mental health, is this person functioning and are they happy? And if not, that's a sign that something needs to be done, steps needs to be taken. And, whether you're going to be the person that sits down and talks with them and works through the challenges or struggles with them, or you're the person that says, hey, do you want help finding some care? And you connect them with a mental health care provider, that's people think that that's not a big role in it, but it's huge. If someone doesn't take the steps to sit down with someone and say, hey, like, I see that you're not happy. Can I help? Can I help get you connected to someone who can help further? that's
Uh,
huge. That person might not ever make it to care if you're not able to do that. And so, yeah, focusing on like removing the stigma and understanding these myths and really just taking small actionable steps. We're not saying everyone needs to be a mental health care provider or have the knowledge around that level, but like knowing someone's not happy and not doing well, what can I do to get them connected to someone who can help further?
yeah, I think in an odd way, this kind of saturation of our minds with these all this mental health information has caused us, particularly in the West, to use these terms very cheaply.
Mm-hmm.
And we just throw them around. And as you're saying, we need to just get rid of that. And we need to say, look, this person's in distress. They're struggling, and I'm just going to be present. I don't need to worry about whether it's depression, anxiety, whatever. I just need to help them how I can. And the first way is to be present and to listen and, and things like that. I think we also have to, another myth that I've heard that's related to that is really this idea that there are no treatments for these things, because I just think people they don't understand mental health care very well. And absolutely, there are effective treatments for depression and effective treatments for anxiety disorders and effective treatments for psychotic disorders. I mean, again, these are chronic conditions, and you may have the condition for a lifetime, depending. Some of them certainly go into remission and relent, but they can be managed. Just like diabetes, I think a lot of times we forget that is a chronic condition. Even though you may not meet criteria for diabetes because your diabetes is being managed, you still have diabetes. Same thing with chronic cardiac issues like high blood pressure and things like that. Easily managed. You certainly wouldn't tell somebody with high blood pressure, well, there's nothing for that. You just need to, pray more. And, I mean, we just need to get a little bit more, I think, compassionate. I think compassion oftentimes, in showing a little grace, I think that overcomes myths sometimes a lot faster and stigma a lot faster than education does. It's really kind of the position that we come from. So you got any final parting words for this topic, myths, stigma in mental health?
I mean, I think I would say here's the plug, right? If you're in a faith community or just, like a school community or anything, and you're going, I think some of our key people here could use some education or some information on how to connect people to resources, or, we're needing some training on how to understand how to help people in our community. I'd say reach out to us. We've got our training department, our Gateway to Hope, and they can definitely, we have a lot of options of what we can do to help equip faith communities and other communities and how to identify mental illness and really take those steps towards setting up a system that they can help people in that community. So I'd say that's my shameless plug, and reach out to us.
All right. Well, thanks for being with us today on Madness and Grace. And Maddie's right. If you have questions about mental health issues, or you need help, or you don't know what to do, just give us a call or email us, and we will help you figure it out, because that's what we do. So please join us next time as we continue our discussions of mental health and faith.